My name's Lydia Hulme, and I was fortunate enough to participate in the Ophthalmology RPIW in July of this year as one of the patient representatives. I have a personal and professional interest in service improvement through my work within the sight loss sector, primarily through guide dogs as both a service user and a volunteer, but also with the RNIB, the Carlisle Society for the Blind, Cumbria County Council, and the Carlisle Visually Impaired Forum. We are looking as a group of organisations to collaborate to improve services offered to those with sight loss throughout the county. The work is in its very infant stages because although it may seem an obvious thing to do, collaboration within the sector has always been minimal. Participating in the RPIW gave me a golden opportunity to further my knowledge of improvement work. One of the things I've noticed as a patient, not only in Cumbria but across the country, is that the NHS are very good at telling you how you're feeling and not very good at listening to how you're actually feeling. As a patient, you can get swept up in the hurry up and wait culture of being passed around different clinicians and waiting rooms while things just happen to you. I struggled to count the number of appointments that were running late after being cancelled once or twice, only to sit briefly with a consultant without actually getting an opportunity to speak, which left me feeling like my care was fragmented and sometimes inaccurate. Being a patient becomes tiring when you witness the same mistakes in your healthcare again and again. I've been sat with consultants multiple times, only to have them say, "We can't locate your notes, so if you just start again from the beginning and give me an overview." I came into the Ophthalmology RPIW without much of an idea of what to expect. From a patient perspective, the term Rapid Process Improvement Workshop meant little to me. I had concerns that it would act as a sticking plaster, covering up problems instead of actually getting down to the underlying issues and dealing with them. I knew from first-hand experience that the department was under enormous pressure. I'd recently had an appointment and witnessed the sheer volume of patients constantly passing through the doors, people standing for over an hour waiting to be seen as there were no seats in the waiting area and staff rushed off with their feet. That, the physical inaccessibility and the size of the department seemed like problems too big to overcome with a one-week RPIW. However, I witnessed how the system changed the team outlook on every aspect of their jobs. The week had something for everyone at every level of patient care. It offered the opportunity for each person to control their own improvement journey, and from my experience, it showed me ways that I can better take ownership of my treatment within the NHS, changing the way I've since gone on to approach appointments. My concerns that the week might be all talk and no action were quickly forgotten. One major issue we highlighted was that many patients don't even know why they've been referred for a hospital appointment, which can result in the appointment being missed. We also discussed how patients don't really know what they're allowed to do. Hospitals are very alien places to the general public and can be quite stressful environments to be in. As patients, we receive letters telling us to be in a certain place at a certain time. Often there's a nervous wait for the appointment time to roll around. We arrive and check in and we're left to wait. Our appointment comes and goes and we wonder how late it's all running, and we'd like to ask someone to help, but everyone seems so busy. So we wait again, and by the time we're seen, we're desperate for the loo, worried about the car park or late to get back to work, and exhausted from waiting. 5 minutes with a consultant and you're out the door and it's all over. All of these factors can combine to make patients feel a step behind in their own care journey. The RPIW gave me a safe space to share honest opinions about ways in which my care and the care of others like me could be improved. I think the ophthalmology team appreciated having patient voices present during the workshop, as they often echoed and validated the issues that the team had been trying to deal with alone for too long. By asking staff to fully explain, in layman terms, why things were done in a certain way, we opened up the discussion to explore other ways to do things. Often the reason that things were done in a certain way was simply because they'd always been done like that, but now the department had the time and the space to ask one another, but what if we did it like this? I was surprised to learn what massive changes could be made within the department. I spoke about how physically inaccessible the department was for patients with low vision. It's cramped and busy, it's cluttered and it's hot, there's no natural light, and the nature of ophthalmology tends to mean a lot of moving from room to room for various tests and scans. I anticipated the response to a lot of these issues to be that they can't be altered. However, everyone in the room seemed to be in agreement that simple changes could be made to the department to make patients feel more comfortable and able to get about, which could in turn free up time for staff, spending less time escorting patients from one area to the next. Throughout the week, we highlighted opportunities to be more person-focused, not just thinking of patients as patients, but as people who need to leave the department and carry on with their lives. We looked at how long waiting times can really impact the lives of working-age people who may be expected back at work after their appointment, or who may need to collect their children from school. We also discussed how the small size of the department means that the area quickly becomes cramped and stifling if patients bring someone to help them, as they're often instructed to do due to the administration of eye drops. We took time to look at what was working really well. The overriding feedback from patients who had filled out questionnaires said that waiting around for their appointment was exhausting and frustrating, but when they did actually receive some care, it was fantastic. Something that every patient could agree on is how brilliant NHS staff are. The RPIW was an educational event for each person in the room for different reasons. Although the workshop happened in a very small time frame, each person took away different ways to improve their own working practice and that of the team as a whole. The week reminded me how much every member of staff, both clinical and non-clinical, really cares about the patients that walk through the department doors. I took a great deal away from the week. I've learned that as a patient, I'm allowed to have more of a voice. Participating in the RPIW has completely changed my outlook on my healthcare and shown me ways that I can implement the tools I learned across other parts of my life. However, I'm aware that very few patients get that opportunity. One area I have a particular interest in my own work is the engagement of service users within an improvement process. People who use services are at the heart of everything an organisation does, yet their experiences are all too often overlooked or simply not correctly understood due to a lack of co-production. I've found this not only in my own healthcare, but also through my experience as a client of various mobility and social services. From an outside perspective, Cumbria, through CLIC, is leaps and bounds ahead of other organisations in its approach to improvement, putting the people that use their services at the centre of everything they do. But there's always room to further involve these people. From my research, even an organisation as forward-thinking as CLIC only mentions patients briefly in the CPS. Co-production relies heavily on defining service users as assets with skills whose capabilities can be built upon, and one of the simplest ways to make that change is to break down the barriers between those who use services and the professionals delivering them. As someone who's relied heavily on the NHS for the last 5 years, it was a true privilege to be even a small part of a team working to improve a system that's had such a huge impact on my life. And the skills I've learnt will stay with me as I continue to learn more about service improvement.